If your very first steps in the morning feel like stepping on a nail, a sharp, stabbing pain in your heel that eases after a few minutes of walking, there's a good chance you're dealing with plantar fasciitis. It is the single most common cause of heel pain, and the good news is that the large majority of people get better without surgery. In the next few minutes, I'll explain, from an orthopedic surgeon's perspective, exactly what plantar fasciitis is, why it hurts most in the morning, how to tell it apart from other heel problems, and the at-home steps that actually make a difference. One quick note before we start. This is The plantar fascia is a thick, fibrous band of tissue that runs along the bottom of your foot, connecting your heel bone to the base of your toes. Think of it as a strong bowstring that supports the arch of your foot and absorbs the load every time you take a step. When that band is repeatedly overloaded, tiny areas of irritation and degeneration develop where it attaches to the heel. That is plantar fasciitis. So why is it worst first thing in the morning? While you sleep, your foot rests in a relaxed, pointed position, and the fascia tightens overnight. When you stand up and take those first steps, you suddenly stretch that tightened, irritated tissue. Plantar fasciitis doesn't come out of nowhere. A few things raise your risk. The biggest is a sudden increase in activity, ramping up your running, starting a job that keeps you on your feet, or walking far more than usual. Tight calf muscles and a tight Achilles tendon pull on the heel and add strain. Shoes with poor support, flat feet or very high arches, carrying extra body weight, and simply getting older all play a role too. Here's a quick self-check. Is your pain on the underside of the heel, rather than the back? Is it worst with your first steps in the morning, or after sitting for a while? Does it ease with a little walking, but flare up again after a long day on your feet? Let's separate plantar fasciitis from the conditions people most often confuse it with, because the right treatment can be different. First, a heel stress fracture. That pain tends to be more constant, present even at rest, and it gets worse the longer you're on your feet, rather than better after warming up. Second, nerve entrapment, where a pinched nerve near the heel causes burning, tingling, or numbness, instead of a sharp mechanical stab. Third, a fat pad problem, where the natural cushion under your heel thins out, giving a deep, bruise-like ache right in the center of the heel. And fourth, in some people, heel pain can be part of an inflammatory arthritis. Now the part you came for. What actually helps at home? Number 1, and the most important, is stretching. Gently stretching your calf against a wall, and rolling the arch of your foot over a frozen water bottle or a ball, loosens the tissue that's pulling on your heel. Doing this before your first steps in the morning can make a real difference. Number 2, ice after activity, about 15 to 20 minutes, to calm the irritation. Number 3, footwear. Supportive shoes with a cushioned heel and good arch support, plus an over-the-counter insole. Take load off the fascia. Try to avoid walking barefoot on hard floors. Number 4, modify your activity for a while. Swap high-impact pounding for lower-impact options like cycling or swimming while things settle, and use short-term pain relievers only as directed. And number 5, night splint. What if home care isn't enough? If you're still struggling after a few months, a clinician has more options, such as physical therapy, a custom orthotic, a steroid injection, or newer treatments, and only rarely is surgery needed. Before we wrap up, here are a few red flags that mean you should see a doctor sooner rather than later. Heel pain right after an injury or a fall, numbness or tingling in the foot, pain that's constant and present even at rest, redness, warmth, swelling, or fever, or pain that simply isn't getting better despite good home care. To sum up, Plantar fasciitis is that classic first step morning heel pain. It comes from overload of the tissue that supports your arch, and the foundation of getting better is consistent stretching, supportive shoes, and easing your activity while it heals. The vast majority of people recover without